Hello, everyone. Thank you for joining me today. It's 8 o'clock in the morning here in Sydney, Australia, but we're going to go live to have a discussion about solving crooked teeth. And if you're seeing this broadcast and watching live, just jump in the comments, and we're going to cover some of the questions that people have been bringing up this week in particular. It's been a great community discussion about how we solve this huge issue of our kids not growing straight teeth. It's a very difficult problem to fix, which is what we're going to cover today, and something that we all need to get our heads around. But it's also something that is, in my opinion, imperative that we all begin to understand. And it's not a simple issue. So that's something that I really hope that you take away from today, is that we're not going to get the overnight solutions, and there isn't one way or one easy solution to how we're going to fix this. It's a whole community coming together to put our minds together to really understand the problem and to fix the next generation's health. One of the big things that's kind of pushed me into understanding this problem, because as a dentist, when you look into a child's mouth or into someone's mouth or your own mouth, you're seeing the oldest health messages that your genes, your environment have interacted to create. And that's what the jaw and craniofacial system really is supporting. And it's so fundamental to your physiology, to your risks of other conditions, that and we've really missed on understanding how important this is. To put it into perspective, if you think about how many kids in your school group used to have braces when you were growing up, and compare that to a schoolyard today, how many kids are having orthodontics today? Is that normal? Should we be having to put metal wires onto kids' teeth to straighten their dental arch? And orthodontics is a great tool to do this, but I think what we're missing is that there's a bigger problem at hand. And then so this goes into getting our minds out of just looking into the nitty gritty. And as a dentist, that was one of the big challenges that I found in understanding the whole body. How do we get our mindsets out of just thinking about the very small? And then an ironic part of that is that we have to actually understand the physiology at such a deep level, and then cross it with a population-wide understanding of the human race and the human species, and that's how we start to solve things. So that was kind of my purpose of today's video, and we're going to start to talk about the solutions. But the real goal here is that for all of us here in this community to begin to think about how we solve this as a race, as a species, as a society. So I hope everyone is well, whether watching. If you have any thoughts during this discussion, I'm going to answer some questions at the end. So just post them in the comments or where you're coming from, and then we can go from there. So the thing that really kind of introduced me to this whole topic was to begin to look at the work of anthropologists and how we look into the history of the human race. And one of the big surprising parts of that is that dental diseases only pop up roughly around the agricultural revolution. What the historians say, with the human race, we began to farm and change our environment. So we stopped what we thought was a hunter-gatherer lifestyle, and then began to choose certain plants and crops to make a continuous cycle of food supply, and to build a society around that. Now that changes human societies considerably. If you think about it, there's you're completely shifting what the entire community is doing once you start to stop migration. Hunter-gatherer societies move around a lot. They interact with their environment. Once you begin to stay in one spot, which is what our current civilization does, then you change our interaction with the environment. And so dental diseases. So if you look at the paleoanthropology, so the fossils of the jaw bones that date before this period, before the agricultural revolution, you don't see dental disease. And it's roughly 12 to 15,000 years. It absolutely disappears on all fronts. Once you hit 12,000 years, it starts to pop up, and this is the first time that anthropologists begin to record tooth decay. They begin to record slightly crooked teeth, and we're not talking about the crooked teeth that we're seeing today. They're talking about slightly misaligned lower anterior teeth, and this is what they're describing there is that the dental arch, the human arch, which is the most preservable part of that we leave in our remains in the earth that future generations find. What human anthropology is based on, bones and teeth, jaw bones in particular, they begin to shrink. And jaw bones show us what a population eats. So if you find the jaw bones of an animal species, you're going to get a lot of information if you understand how to extract that from the way that the animal eats, the way its environment, and even now they're starting to understand the analysis of the minerals and everything can tell us about the nutrition. And but the shape of the bone in particular will tell you, how nourished and how how strong, how virile, and how whether this was an organism that survived well. So at the agricultural revolution, when we begin to change how humans lived in societies with each other, and how we sourced our food, that's when you begin to see jawbone change. And this is a big thing that we need to get across in society, because what we're seeing today in kids, in ourselves, isn't the normal human condition. Because when you place that perspective, that length of time on a timeline of that we have human records walking on planet Earth, it's nearly nothing. It would barely be a fingernail on the timescale of records that we find humans. And so what that's showing us is that something has changed absolutely drastically to the point where we are, crumbling the foundations of our health. And this is where functional dentistry really begins to dig in to understand, how do we solve, 90% plus of the conditions that we see today. It's by understanding this jawbone issue, because that's the problem that began to step us along to the modern condition that we're in today. And we have to take that perspective. We have to step back and see that, look at the human jaw, and understand that there's a deep history of our species on planet Earth, and that we need to understand that how we interact with our environment changes this jaw, and how that then flows on to our risk of chronic diseases. And also, what are the factors that changes the jaw? And so all of those things begin to come together when we start thinking functionally about teeth as a marker of health, but also the historical lessons that they teach us. So when you're looking at a child's jaw today, you're seeing something that is remarkably different from our ancestors. And you can spot that if you compare to grandparents, what your children's teeth to, if you have grandparents, if they're great grandparents, that's a great marker. Were 2 to 3, coming up to 4 generations of people that have been in now the industrialized diet. So if we talk about the agricultural revolution, that's roughly 12,000 years ago. Now the industrial revolution happened, roughly 300 or 400 years ago. That's when we started to step this up. That's when we began to really mobilize how we got processed food, and changed, how convenient of food is. And you can't deny that that's a part of our modern society today. So that was a big step as well. So there was actually 2 big changes in the fossil record when you look at jaw degeneration. And one happened at the agricultural revolution when they begin to record these dental issues, and then the others happen at the industrial revolution when we begin to step it up. And so it's important to see that is that most people today, obviously today we are a product of that industrial revolution, but that's a huge step up on what anthropologists were recording, which was a huge anomaly anyway. So we're stepping anomaly onto anomaly, and then I would argue that we've got another one in the last 5 decades, the last 50 years that we've stepped it up again. We're moving into the technological revolution now, with things like AI and all sorts of technology, and how that's going to affect our food supply and society. That's stepping us up again. That's disconnecting us from the natural cycles that pull the jaw. And there's a comment here from Al Soto, a history lesson. Teeth tell us exactly about our history, and that's why this is so important, because our physiology is tied with our history. We are a product of our ancestors who survived, and we need to learn that. And that's one of the most rewarding things that I found, about starting to really understand the teeth and jaws, is that we need to really get a hold of what they're telling us, because if you don't know where you came from, how can you possibly solve the problems at hand? There are so many problems in the world right now that we are trying to not see and understand, and without any kind of anchoring of where we came from, it's all just noise. And so teeth teach us that. And if you can't have a control of your health in any meaningful way, how can you really control any other factor in your life? And that, for the patients I see, there is a sense of hopelessness with dental disease, because we really don't you don't see any hope out of it, because we've lost the perspective of what your teeth are trying to teach you. And so that's history and teeth are intimately, just absolutely intricately connected. So I think that, for me, that's been such a huge change in perspective, and one that I hope that, this community can really bring forth and start to take out into the communities, that we need to understand our health via our mouth and our jaws and what our ancestors did. And then things begin to make sense. And the amazing thing is it starts to make sense physiologically too, because now if we look at that historical perspective, we begin to ask questions. So why would a jaw begin to shrink? Why would teeth start to decay? The physiology begins to teach us that. And the irony of that is that it's only been in the last 2 decades, really, that the scientific perspective, the scientific community have started to piece together enough of the smaller pieces of the smaller understandings of the human body physiology to really put together a picture of, how nutrition then relates to craniofacial growth. In the early 20th century, modern medicine really regulated this idea that we have a silver bullet to everything, antibiotics and treatments and surgeries, which are great, which we need, but it lost its way in understanding the nitty-gritty physiology. And so when we step back with anthropology and think about, where our ancestors came from, what our teeth are telling us, what our jaws, what the next generations, what the crooked teeth in our kids' mouths mean, well, it then starts to get our minds ready to really understand the physiology as to why that's all happening. So deep history and very detailed physiology, that's how we solve the problem. It's a huge area to understand, to be honest. I've been digging into this for 10 years now, but it's possible. We're at the stage now where we can explain how a jawbone doesn't develop because of nutrition. And we're at the point now, I feel, that we need to have very direct conversations about how the food that we feed our children is going to affect their craniofacial growth and what impacts that has on their life. because as a society, we know that this affects humans at societal level, because when our ancestors changed these things in their societies, they began to experience these issues. And it becomes a societal issue because if you don't value what is happening here in the teeth and jaws, you don't build the systems in society for people to be able to fix it. And that's the big problem point. We get a lot of questions, about, well, how do I fix this? And I'm going to go through some of these questions at the end. But how do I fix this in my child? I'm kind of throwing a problem at you, and you're seeing it then in your kid. Well, people then begin to realize that we have a society that doesn't understand this at all and isn't set up at all to fix it. So there's a huge need for people to start talking about this and to start a conversation, because if our kids are growing up without the proper diagnosis, so the understanding of the risks of certain diseases, that improper jaw growth then imparts in their life, moving forward, then how on earth are we going to have a system in place for them to receive the correct treatment and the correct recommendations for parents to be able to correct this? So, and parents, I feel, are the ones that are feeling this the most at the moment, because if you go to a doctor, if you go to a practitioner that doesn't understand or perhaps doesn't talk about the growth and development of the child's jaw like this, then they're going to come away with a sense of hopelessness. Well, this conversation here, what I'm trying to get to here is that this message is coming. It's a big one, so we kind of have to sit back and go for the ride. But we really need to kind of get our minds set for where we are. Why, for instance, parents haven't been told this before. Well, it's a misunderstanding. There's only been a very recent, progression of medical research, scientific understanding to really kind of underpin, can we change the jaw growth of a child? Yes, we can. We're doing it here in the clinical, every day. It's difficult, but the factors are there. So let's start to talk about, what are these factors? So what happens at the agricultural revolution that starts to bring on this risk factor for dental disease? The raw point there is food. And this week we've talked about some of the different parts of the modern diet that strip out the factors that grow this jaw. Food grows the jaw. So we establish that. So right, okay, so food grows the jaw. What are the factors that grow the jaw? Well, they're the nutrients that control calcium, that put calcium into bones and teeth, that control the factors that tell the body to grow and to mineralize the jaw bones, the muscles and the joints that support the bones as well, and the postures, the breathing that directs the postures. All of that starts to come into play as to how this begins to grow. So nutrients are at the core of why our teeth and jaws begin to get dental disease. We start to strip out the nutrients and just to go back a little bit, there are populations that were living right up until, they're living today, they're becoming more and more isolated now, that have lived on traditional diets that still do not to this day have this jaw growth issue. We still have this human form around. It's just becoming rarer and rarer. So people lived, even though in certain pockets humans were having this issue with their teeth and jaw degenerate, they still lived on traditional diets right up until modern day, because they stayed in their technique. So there was a tried and tested way to feed our kids that we lost, and once you deviate from that path, that's when everything starts to collapse. So going back to those nutrients, once you strip those nutrients out of the diet, the jaw begins to collapse. We begin to, it doesn't grow as much as it needs to fit adult teeth. And if you saw the post this week about a child's jawbone, so if you see the fossil of a child that unfortunately died when they're growing and developing, then you'll see all of the adult teeth. But you can actually take this this picture and in the next few weeks, I think we'll do a session just looking at some radiographs just to see how you can actually diagnose crooked teeth early. And you can see it in just by looking at a kid, but then radiographically and with scans, you can get a much closer diagnosis. This is what orthodontists do, and surgeons and so forth when they're thinking about doing jaw surgery. There's a way for us to pick this up early. But my point here is that, well, we if we understand this right from the get-go, you don't even need the scans to see it. Like it's that obvious. You can pick these issues up sometimes in a newborn. You can start to see that the lower jaw in newborns aren't as forward as they used to be, and that there are functional issues. And so what happens when you think of a musculoskeletal issue, you have joints and bones and the hard structures, but then you've got the muscles that function with them. And when the muscles incorrectly or have to take on an adaptation kind of posture, then it starts to distort the way the bones work. So what happens is that when you use this system differently, it begins to grow differently. Just like if you train an arm or a leg muscle differently, it begins to grow differently as well. So that's why teeth, there is both a nutritional drive, which there is a lot to kind of that understanding, but there's also a functional drive as well. So kids today are lacking the nutrients, and they're also lacking the function, which is the support for these jaw bones, for the maxilla and the mandible, the upper and lower jaw, to expand properly. It's to do with breathing, because breathing directs how we posture, because when your skeletal system basically is designed to mold around the airways. And so a lot of kids, so one big sign, if you see in a kid today that their head is tipped forward a lot, or their the back of the neck, the cervical spine tips forward instead of being straight up, so tips forward, then that's a sign that they are compensating for their airway. And that forward head posture is going to affect the growth of their jaw. So we have an issue where the heads, the craniofacial structures, aren't sitting upright on our cervical spine. This begins to go into the work of body workers, and where head, neck, jaw pain, so forth, are symptoms of this system all out of balance. But in kids, you can see, for instance, that so recessed shins, head forward, mouth breathing, all begins to push them into a developmental process that is not going to allow them to grow enough to fit their teeth. And so if you saw the post a couple of days ago on the milk teeth and adult teeth, so kids will grow 20 milk teeth between 0 and 5, and then at between 5 to 12, 6 to 12, they will begin to lose these milk teeth. So it starts at the lower anteriors. They're the first ones that go, and then they lose their upper anteriors, the upper front teeth around 6 or 7. And then the big adult teeth start to position in. And it's around this age of between 6 to 7 that if you get a functional diagnosis, if you can really start to see the space that is required for the adult dentition to fit. And that's what, I've found in my practice that I really try and, get across to parents, is that at 6 to 7, kids are about to go into the biggest growth phase of their life. They're about to lose 20 milk teeth, and they're about to have 28 adult teeth, and then later on their 4 wisdom teeth when they're 20. They're all start to pile into their mouth. In this period, they need to grow amazingly. So they really go from this smaller child to this more developed, and then moving into prime to become an adolescent, which is the transition into an adult. So their faces are changing remarkably, and that's how you can tell the age of a child when you look at their face, is that the developmental factors, of their jaws and teeth, because you're spotting whether they're going through this phase or not. And we've all got this intrinsically built into us, by the way. Humans are the brain is incredibly programmed to look at the face, to read facial expressions. There are hundreds to thousands of facial expressions off all of the facial muscles, because this system is connected to how we communicate with each other. And we also, facial attractiveness, and when you look at movie stars, they have this very kind of square jaw, and it's because it's telling our evolutionary biology, or biology, in a sense that there is good physiology here. Let's just say physiology, because when you sense good physiology, that kind of increases your desire to mate with someone, and that's how it's all impinged in the face and brain, and so the jaw structure is incredibly connected to this, and how we communicate, how we smile. Smiling is such a, it sends endorphins to the brain. All of this is affected when it doesn't grow correctly. And, we're talking about very, very fundamental aspects of the human form here that is deteriorating kids. So when a kid, 6 to 7, they begin to grow, you can start to see that as those adult teeth begin to poke through, there isn't quite enough room. And then, so these are the warning signs that are starting to sound. It's like, well, and there's a functional issue here. So we mentioned that babies, even in the womb, potentially are not growing jaws today. So it can start very early. But the message is that we can intervene in this. So if you change kids' habits, so diet and breathing and the way the tongue sits to the roof of the mouth and the swallow and the posture, it's a hard thing. Now, I have to get this, this isn't an easy fix, and, you're not going to get one thing that changes it. But once you start to see it, once you begin to talk to your kid about nasal breathing, about the tongue, about getting the right nutrients, you will start to see results. And more so, in what we really need to get out to at a societal level is that the kids that do have severe forms of more severe forms of improper growth in the jaw. So that's a high palate, or their jaw sits back in an overbite, or you have a crossbite where the lower teeth sit in front of the upper teeth that holds the upper jaw back when you can see that in kids earlier too. If you get your kids to bite together like this, and you look at the alignment of the teeth, if the lower teeth any along the arch, so you can have anterior crossbites or posterior crossbites, that's a big warning sign that the upper jaw isn't sitting correctly, and it can actually be held back. So one thing with that is that chewing is a fact. We didn't mention that, actually. So anthropological studies show that once we strip out the chewing factors in a diet, we begin to lose this growth of the jaw. And so just looking at that fact, Robert Corricini, who was an anthropologist, began to show that people living in rural compared to urban societies in Kentucky, the US, their jaws begin to shrink just from losing the chewing factors. So the factors so identification is really important. And just to let you know, what a functional dental practitioner or sometimes it's a sleep doc or it's an ENT, all these doctors are looking at different parts of a growing child or an adult's craniofacial system. You need to get the right diagnosis. You need to understand what's happening. But at the core of it, it's all pulling back to this growth issue that our whole society is experiencing. So I'd just like to add quickly that there's a lot of anxiety with this with parents once they realize what's happening, and it's difficult to get, one thing I want to try and get across is that everyone is experiencing this. So you're not alone. Your child isn't alone. You are not alone. We as a whole, the human population is experiencing this. So the sense of anxiety, there should be urgency, but you really need to kind of just go with it. It's also a long process. Between 6 and 12 is 6 years. So even doing a myofunctional orthodontic program where kids will expand their jaw, a lot of the time, we see quick results. So we take photos monthly, for instance, just to see how the jaw is changing. You can take photos of your kids' teeth as well to see, if you think a tooth needs more space, if you're watching a lateral incisor come in and you're not sure, for instance, if there's going to be enough space for it, you can take photos of it and record if you think, because sometimes the kid will have a growth spurt, but you have to then get their functional factors right for it to work. So you have to get them to close the mouth. You have to get them to breathe through the nose through the night. It's very, very important that kids breathe through the nose all through the night, because that expands the maxilla. And so that's the first thing you need to spot, is that if kids are mouth breathing through 8 hours of sleep, they are, one, they're not going to get the deep levels of sleep that they need, but two, they're going to put compressive factors on the jaw. So I'm going to go through some questions now. We had a few questions from before too. Okay, so Karen Van Kempen says that my 4-year-old son has crooked teeth. We lightly tape his mouth at night to change breathing habit, and finally have stopped him putting his fingers in his mouth. Should we do more? And if so, what? Okay, Karen, so it's a great question. So look, to firstly say that you at 4, you are very early in the growth cycle. So those implementations that you put in are going to be very effective, because that's going to continue the growth of your son's jaw right throughout his, and he's got years before his teeth will become loose. So all of these things are going to help his jaw. Now, can we say, should we do more? Well, I would say nutrients. You really want to make sure that he's getting enough of the fat soluble nutrients, because that's going to be the driving factors. And then you get the car ready, you get all the functional things set, and the kid grows. So I would say the things that a 4-year-old should be addressing is nutrients, and that's really kind of a family dietary change, which is difficult today as well. We might do a discussion next week on this, how to kind of implement what I do for my kids, for instance, and because it's difficult to get these nutrients into the diet. Okay. My 12-year-old son has crooked teeth. Do we still have time to correct this naturally without braces? Now, so at 12, the adult dentition is most likely nearly set. So I would say correcting, depending on, you can't tell without a diagnosis, but it's going to be very difficult. You can change the jaw, and so what happens is between 6 and 12, you have a big growth phase where kids are they're like putty, they change really quickly. You put an expander in there, they change. You change a habit, the jaw, has remarkable changes in very short times. At roughly 12, things start to slow down. So they reach the adolescence. The adult teeth, the 28 adult teeth back to the second molars are set. So correcting naturally from there is very difficult. Correcting teeth in general is very difficult. You can do it. I believe you can do it naturally, but it is very, very difficult. So I would say that at this point it would be hard. So you want to get a proper diagnosis, and you want to make sure you've got all why this is happening in the first place. And I would say you can probably change the jaw, but it's going to be difficult. Okay, so how do you make sure a child is nose breathing, especially at night? Is taping their mouth a safe thing to do? And that's a good question. You should be very careful about taping a child's mouth. What I would do is to have exercises in the day consciously with the child with closed lips. So you have times, and so this goes into there's breathing techniques like Buteyko, and my functional therapist will help with this as well. But so sealing at night is sometimes helpful, but you really want to make sure that the kid is comfortable with that. And whilst taping should always be very, very light if you do it, you should be very careful with how we seal a kid's, and make sure that their airway and that they are comfortable with breathing like this. So I would be saying that you want to make sure that our daytime breathing translates to nighttime breathing. So the way we create lip seal, it's a hard thing, because I myself, I've tried to go through the whole reprogramming to keep lip seal at night, and I still don't. So I still tape, because when I don't, my lips open, and I can tell I have a dry mouth, and I just don't sleep as well. So I do tape. But for kids, the big thing is you want to get their habits in the day, and then there are orthodontic devices, for instance, that help breathe through the nose and so forth. Does the brain heal well if mouth breathing is corrected during puberty? That's a good question, actually, because mouth breathing and this whole problem that we're talking about affects the brain profoundly. Because when the jaws don't develop, the base of the brain is actually constricted. So what happens is that when you've got a structural problem that the brain is sitting in a constricted base to start with, and we're going to go into this a lot more. There's a lot to the kind of the neuroanatomy of it, how the cranial nerves, you got 10 cranial nerves there. It's just fascinating, and the jaw, the jaw growth affects all of that. So what happens is that you breathe through the nasal sinus. So mouth breathing, we talked about it earlier, that changes the posture of the mouth, and can compress how the jaws expand. When we mouth breathe, we also change the brain's response to carbon dioxide, to oxygen levels in the blood, so how gases are exchanging. So what your brain is doing is it actually measures gas exchange in your blood, in your lungs, and so forth, and it will change breathing patterns to make sure that's okay, because your brain is constantly the one thing your autonomic nervous system is doing is to check if you're breathing. So when you have improper gas exchanges happening and you're delivering cold, unfiltered air through the mouth, the brain learns to deal with that, and they create a behavioral pattern that survives, because we are survivors, and that's what mouth breathing is. It's surviving, but it's not ideal. And so it's part of it. You have to retrain the brain stem to be able to tolerate slow flow nasal breathing. So it feels like you kind of choke. The brain will feel like it's kind of choking. You kind of have to get over that. And breath work helps with that. Yoga, for instance, my functional therapist helping in potato breathing is a great technique too. And so deep diaphragmatic breaths, that's telling the brainstem to calm down, and it's going to get there eventually, and then you have to actually let the gases, that the arterial, the vessels actually get the chance to have exchange. And so the alveolar expand, and then it sits in the pressure, all the gas exchanges, and then you exhale. So slow inhales and exhales is a much different response from the brain. You actually need the response from your brain. That's why when people first start to wear myofunctional devices, where they first start to tape the lips, then you get a struggle period. So yes, you have to reprogram the brain, and yes, it does change your brain, because especially if you sleep in this breathing pattern, you're going to allow the brain to stop worrying about the gas exchanges and whether it's going to survive or not, and actually worry about cleaning up the digestive system, cleaning up the immune system, cleaning up all of the gunk that fits up in the brain. When you don't breathe properly, all of that doesn't work. So a very great question there, because it leads into a lot of the things we're going to be talking about, is the effects of all this on the brain. But yes, so if we change mouth breathing habits, your brain will change as well. Okay, so I hope everyone has enjoyed this talk. If you have any other questions, please put them in the comments, and we're going to continue to have this discussion. There are lots of professionals here in the community, so ask questions of what other people have done. There is no one answer to this, so my answers aren't all this. I'm just trying to get this out as a problem. So make sure you go to as many sources as you can to be able to understand this whole thing. I'm just trying to understand this as well, and I'm just hoping that parents and people that out there can really start to begin to, feel that this is an issue. And then I think we need to be talking about this every day. I think all your family and friends kind of need to, if they're not aware of it, maybe bring it up with them, because, I think as human beings, we need to understand this issue that is potentially changing the course of where we're going as a race. I think we're potentially stepping or heading towards a cliff that we may not be able to turn away from if we don't stop this jaw growth. So I thank you all for joining me today. Please leave any other questions in the comments, and we'll be coming back next week for another topic on functional dentistry. Have a great day. Bye.